In this presentation, we propose a lightweight sonication efficiency estimation toolkit for transcranial focused ultrasound. Transcranial focused ultrasound using a large phased array transducer has become an alternative ablation modality to treat numerous brain diseases. A tool that can estimate the performance of transcranial focused ultrasound prior to the operation could be beneficial for the treatment planning. A considerable distortion and loss of acoustic wave through the skull layer was measured by many studies, and this is the main challenge of focused ultrasound on brain application. Like the physics of any other wave propagation, a significant transmission loss was occurred on the boundary of two materials, which has considerable impedance difference. The short wavelengths of the therapeutic ultrasound compared to the skull thickness may also result in a phase delay of transmission wave. Moreover, the inhomogeneous structure of the skull may result different absorption coefficient on different skull regions. Different approaches were proposed to estimate the sonication efficiency. A full-wave simulation approach provides a comparable result with measurement. However, it requires hours of computation time, limits its adoption on clinical setup. A faster computation model based on hybrid angular spectrum was proposed recently. However, the computation cost still beyond the clinical practice could affordable. We proposed a multi-layer ray tracing method which could predict the phase delay caused by the skull layer with a sub-second computation time. Nevertheless, in clinical treatment, analytical parameter called score was used to estimate the efficiency of transcranial focused ultrasound. The skull score was simply defined as ratio between the mean values in the Hounsfield units for marrow and the cortical bone. This oversimplified single factor cannot sensitively predict the acoustic wave distortion caused by the complex acoustic property of the skull. A model could count multiple factors that affect the acoustic wave distortion with acceptable computation is in demand. In this study, we propose the sonication efficiency estimation by counting above-mentioned factors such as skull porosity, skull region-specific skull density, and incident angles. A phased array transducer, coordinate, and the patient-specific skull volume need to be placed and visualized in the same domain to mimic the treatment scene. To register the transducer and the skull volume, the coordinate of each transducer element, skull volume data, and the relative transformation metrics between transducer coordinate and the skull data were required. The cranial software was used to translate the treatment record data exported from the clinical system to MATLAB readable information. After reconstructing the virtual treatment scene in MATLAB, the acoustic wave propagation through the water skull brain layer was simulated based on the rate-based method, and the total transmission coefficient of sonication was estimated. The significant parameters that affect transcranial focused ultrasound efficiency, such as skull density, thickness, SDR, incident angle, and solidity, were estimated and visualized. The total transmission coefficient combines the transmission coefficient of acoustic wave on the water skull and the skull brain layer, and the absorption coefficient of the skull medium could be evaluated with patient-specific CT data. In summary, a fast sonication efficiency estimation model counting multiple factors was proposed. This toolkit could be beneficial for transcranial focused ultrasound planning, post-review, and new transducer pattern design. I would like to thank Dr. John Snell for his work on development of cranial software, and this work was supported by the Focused Ultrasound Foundation. Thank you for your time and attention.